Hello, Ms. Smith. My name is Claudia. I'm the nurse practitioner who will be doing your health assessment today. We're going to go through a fairly detailed medical history here, and I want you to just add whatever information you feel is important. Okay?
Okay.
All right. May I verify your first name?
Lois.
Okay. Lois, your date of birth?
12/4/1937.
Okay. And how old are you?
77.
All right. And today is the 20th. Can you tell me if you're married?
Yes.
And are you working or retired?
Retired.
Okay. Do you have any allergies to medications or food?
No.
Tell me how tall you are
4'9".
and your weight.
148.
Have you checked it recently?
Yes.
Okay. We'll later check your blood pressure and get some vital signs before you leave today. Can you tell me the chief reason that you're here for the surgery consult?
Because of my back, my vertebrae, and I lean to the right and have a hard time walking. It makes me short of breath when I walk.
Mm-hmm. Do you use any assistive device to walk?
I can.
Okay. Do you have any other illnesses right now?
I take medication for diabetes, some depression.
Mm-hmm.
I take a shot that I just started for bones, strengthening bones.
Mm-hmm.
Did I say blood pressure?
No, but I'll add
I
that.
had blood pressure.
Okay.
I take for sugar.
Okay, so diabetes?
Yeah.
Okay.
Okay.
And I'm going to go through a list
I take
later.
some pain medication.
Okay. All right. Is that about it for the list? Are you having any respiratory problems today? Any additional illnesses you're treating right now? Okay. Well, let's start with that symptom of pain. That's one of the things you would like to have relieved with your surgery. Can you tell me where, all of the areas where you're having pain right now?
In the right back, from my waist down and around to my abdomen.
Okay, radiates to your abdomen.
Yes, and then I have a burning sensation on the left side from my waist down a little ways below my waist.
Okay.
And this gets worse as I walk.
It's aggravated by walking?
Yes.
Okay. How long do you need to walk before it starts hurting?
Maybe sometimes 5-10 minutes.
Okay. All right. Are you having pain anywhere except for your right lower back and your left back?
I have some burning sensation from my ankles about halfway up my leg, my lower leg.
Both ankles?
Yes.
And halfway up. Does that include your calf all the way up to your thigh, or
No.
just the calf and lower?
Lower.
Okay.
And my right leg, after I walk so long, I start having a pain when I step in my muscles of my right front of my thigh.
Okay. Right front of the thigh. For each of those, can you tell me when you are walking if the pain is mild, moderate, or severe?
It gets to be severe.
Okay. And you said with walking for 5 minutes, you usually feel each of these sensations. Is that correct?
Well, the pain, first of all, and then I get the burning on the left side.
Okay.
But the legs, that just comes on. Not necessarily from walking.
Okay. That was the lower legs.
Yeah.
Okay. You don't know how long that takes. It just starts with walking.
I never paid any attention to that.
Okay. For each of these, what do you do to relieve the pain and discomfort?
Sit down or lay down.
Okay. Lying down also helps. Do you have pain medicine or topical creams that also help you? You have both?
Yes.
Okay. And we'll make a list of all of your medications at the end today. I was recently informed that you're on Forteo. I think that's the way that that was the medicine for osteoporosis. You told me before that you were on supplements. Let me just...
Vitamin D3 and vitamin B12.
Okay, very good, very good. When you were listing all of your problems with walking. You also mentioned shortness of breath. Let me go back to that a minute and ask you what causes the shortness of breath.
It's just where I lean and my ribs go down, and then I apply pressure on my right lung.
So that posture is making you feel short of breath.
Yeah.
And is that mild or moderate shortness of breath or severe?
Well, moderate, I would say.
Okay. Does that happen just with the change in posture or with walking or both?
When I'm walking.
Okay. And what do you do to relieve your shortness of breath? Do you have any inhalers or?
No, I just sit down.
Okay, very good. And we have your medication, so I'm going to go on and ask you what kind of diet you're following right now. Is there a heart-healthy diet that you're on? Okay, but typically what do you eat from day to day?
Breakfast, I have cereal sometimes, and sometimes I have egg and some type of meat and toast.
Okay.
Maybe 3 times a week.
Okay. And that's 3 times a week. And what kind of meat do you eat? Is it usually lean meat or?
It's lean meat.
Okay. What do you eat for dinner? Give me a good idea of what is included there.
Well, mostly I eat soup.
Okay.
Sometimes it's spaghetti. Every now and then cook something.
Okay. And when you cook your meats, is that by baking, roasting, grilling? Okay, baking. Okay. You mentioned soup. Are those homemade or are they canned? Okay.
Well, I make soup sometimes, but mostly canned soup.
Okay. Do you exercise?
No, because it causes more pain.
Okay. And with the smoking?
No.
No smoking at all? Never?
No.
Okay. Do you drink alcohol?
No.
How about any illicit drugs?
No.
Okay, very good. Let me ask you to list all of the childhood illnesses you can recall.
I had whooping cough, chicken pox, mumps.
Okay. Any others you can recall as a child?
I think if I didn't have measles.
Never had measles? No. Okay. You've already listed these illnesses, your back problems, diabetes, and your back problems are in the lumbar. You said lower back, correct?
Yes.
All right. And high blood pressure. I will check your medications, and you do have Lipitor here. That's usually for cholesterol. Are you still taking that?
Yes.
Okay. So let me add cholesterol. Any other illnesses that your doctor has treated or diagnosed you with?
No.
None? Okay. Could you go through what surgeries you've had and go back as far as you can remember?
I have had back surgery on my vertebrae, lower vertebrae. I've had a neurosurgical stimulator put in.
Okay.
I've had gallbladder, left and right hip replacements, a left partial knee replacement, a hysterectomy.
Okay. Anything more?
It's hard to line them all up.
I know.
Thyroid.
Okay, was your thyroid removed?
No, my thyroid was fine.
Okay, so was that a growth?
Yes.
It was? Okay. Any other back surgeries? Do you have a vaginal birth? No C-section? Okay. Any abdominal surgeries?
No.
You mentioned you had back surgeries. I forgot to ask you how many have you had?
I've had the one on my vertebrae.
Just one?
Yes.
Oh, okay. I thought you said more than one. All right.
Well, I had that neurostimulator put in.
Right. Okay.
And if I had another one, I've had so many.
Okay. Well, I want to go through a couple of recommendations. For prevention of stroke and heart disease, they recommend that your blood pressure is within range, and I'll give you information about the healthy range for blood pressure, that you control your cholesterol and you're on a medication. Has your doctor told you if your cholesterol is out of control?
No, he said everything was fine about a month ago. I had a report. And my sugar was normal. My blood pressure was very good.
Okay. We'll give you recommendations for diet today that helps to control weight, and it does prevent disease. For stress, do you have a way of coping with stress? Like, do you have to read or watch TV, or?
I just talk to myself.
Okay, you can talk yourself out of the stress. Oh, I wish we all could do that. All right, and another recommendation is for most adults to be on an aspirin regimen if they're on any heart disease medications.
Never recommended that.
Okay. Low dose is usually recommended, but the doctor will review. Yeah, that's always a good idea. Now, for cancer prevention, a good diet can contribute to that. And we may have some recommendations about supplements as well that can help you with prevention. You said that you were on medication to prevent osteoporosis from progressing. Exercise can help with that, and after your surgery, we'll recommend you go to physical therapy to start an exercise regimen. For viruses and colds, the best prevention is to wash your hands. So we'll continue to talk about infection control so you can stay as well as possible in this respiratory illness season we're having. Okay, what about immunizations? Have you had a tetanus recently, tetanus shot?
No, I haven't, but I asked the doctor about it one time when I stepped on a nail, but he said I didn't need it.
Not at this time.
I've had shingles shot, I've had pneumonia shot, and flu shot.
Those are up to date?
Yes.
Have you ever had a hepatitis B or C series? And you mentioned shingles. Are you having an annual PAP with your gynecologist?
No, doesn't recommend because of my age. I do have a mammogram.
Mm-hmm. Okay. Any vision screenings? Are you seeing an ophthalmologist annually? Okay. And bone density tests, you said, were done recently, and that's why...
A couple weeks ago, but I don't have the reports yet.
Okay. You said that your colonoscopy is due? Is that correct? Okay. And do you know, I was talking about exercise for prevention, but I didn't ask you, do you have any exercise equipment at your home?
Yes.
Okay, what type?
Treadmill, stepper, one that you hang upside down.
An inversion board?
Yes.
Okay.
And I have a bicycle that needs to be fixed.
Okay, what type of bicycle? Is it a tall bike or a recumbent bike?
Recumbent bike.
Okay, good. You have a whole gym at your house.
Now
Now I'm going to ask you about
I have a Bowflex.
Okay, so you can have some resistance exercises or exercise equipment. That's good. All right. Well, I would like to know about your family history, starting with your mother, if you'll tell me her age and the cause of her death.
She was 57. She had a coronary thrombosis.
Okay. And your father, his age at the time of death?
He was in his early 70s and he died in an auto accident.
Okay. You said you had brothers?
Yes, I had a brother who was 28, was killed in a railroad accident where he was working. And my other brother died of needing a bypass surgery redone, and he didn't have it redone.
Okay, very good. How old was he, your other brother?
He was 62, I believe.
Okay. And you said he had a heart attack?
Yeah.
Okay. Had he had a bypass surgery?
Yes.
He had, okay. Let's see, your grandfather, do you know anything about his age and
He was
how old he
in
was?
his 60s and he had some type of cancer. My grandmother was a diabetic and she had a heart attack.
Okay, how old
On
was
my
your...
mother's side.
Okay, this is your maternal grandmother.
Yes, and my paternal grandfather, I don't know really what he died of, but he was 87 years old. I think he had some type of blood problem. And my grandmother, she died before I was born. I think she had heart problems.
Okay, this is your paternal
Yes.
grandmother. Okay. All right, you have any children?
One, he's 52.
Okay. Does he have any medical conditions that he's managing?
No, not that I know of.
Okay.
Just sinus allergies.
Okay. Do you have any grandchildren?
Yes, I have 3 that are 6 years old. Triplets.
Ooh, how fun. Okay, so I'm going to go through a list of medical conditions, and you've mentioned a lot of them already, and you can just say, yes, I know that someone in my family has had that, or no. Okay? How about high blood pressure? You mentioned that for yourself. Anyone else in the family? Kidney disease?
No.
Anyone plagued with headaches?
No.
How about drug abuse?
No.
You mentioned that you had folks, your brother in particular, had heart disease.
Mm-hmm.
And what about stroke? Anyone have stroke? And tuberculosis? No. Any seizure disorders? Allergies?
No.
Anyone else in your family have cholesterol issues? No. And you mentioned yes to diabetes. Asthma?
No.
Any mental illnesses treated in your family? And you did mention that there was cancer in your grandfather, but we don't know the type. Thyroid issues in anybody in your family? How about lung disease, like pulmonary disease, asthma? No one? I think I asked you about asthma twice. Anyone commit suicide? Have any emotional problems that led to that? Do you know if anyone was born with a genetic disorder in your family? Okay. Tell me what you're interested in. What kinds of things do you like to do?
I like to sew, crochet,
Okay.
embroidery, style sewing.
Okay.
I like to get out in the yard and work.
Okay. All right. Are you working or retired? I think I asked you that. You are. And what was your highest level of education?
12th grade, some college.
Do you live with your spouse?
Yes.
Anyone else live in the house with you?
Yes.
Who's that?
Son, daughter-in-law, and triplets.
Okay, that makes for a big household.
Yes.
Any sources of stress in your life right now?
Not really.
You mentioned a lot of things you like to do. Is there leisure activity that you like to do? Play bingo, go to movies? Not right now?
No.
Okay, what's your religious belief?
Protestant.
Okay. You're a regular churchgoer?
No.
Okay. And what are your daily activities? You did say that walking really limits what you do from day to day. Has it?
Do housework.
Okay, so you limit it to housework. Just, are you doing everything, or you stick to light housework?
Yeah, basically everything.
Okay. Are you able to shower and
Yes.
dress independently? Do you need assistance with any of your, like bed making, some of the basic things that get you ready for your day? So you are independent with those. We talked about exercise and diet already, so I wanted to ask you about regarding food intake every day. Is it inadequate, like very little that you eat each day, or do you think it's average, or more than you should eat each day?
More sweets than I should eat each day.
Okay. Do you drink coffee or tea?
Coffee and some tea.
How many cups of coffee a day?
Oh, 4 or 5.
And tea?
Usually 1.
And that's every day?
Yes.
When you drive, do you use a seatbelt?
Yes.
Using sunscreen when you go out in the sun, when you like to do that yard work? Is that on a daily basis?
Yeah.
Okay.
I like to go out daily.
Okay. Have you noticed any recent weight changes?
No.
So you stay pretty steady?
Yes.
Okay. Having any weakness or excessive fatigue? Are you feeling like you're excessively sleepy in the daytime? Tell me about that.
I get sleepy. I sit down and get quiet, I fall asleep.
Okay. How many naps do you take a day?
Depends on how many times I sit down and get quiet.
Do you think you take a nap every day?
Yes.
About 2? How much sleep are you getting at night?
Oh, maybe 4 hours.
4 hours, and then you wake up with the pain? Is that why it's limited? Okay, when you take those 2 naps during the day, is that an hour at a time, or?
Basically, yes.
So that's 2 more hours during the day. Okay. You said you had no other illnesses going on, so you don't have a fever today.
No.
I'm going to go through all of the body parts and ask you to tell me yes or no if you've been having any skin issues like rashes, sores anywhere. Is your skin excessively dry?
No.
Any changes in your hair or nails?
No.
They're not getting any more brittle? Okay. Stomach problems, starting with swallowing. Have you had any issues with that?
No.
Heartburn?
No.
Are you having any changes in your appetite?
No.
How about nausea?
No.
Do you feel that your bowel habits have changed in the last year or so?
No, they're still the same.
Do you have a bowel movement? Oh, it's constipation. How often do you have a bowel movement?
Depends on how often I take stool softening.
So does that depend on taking those? Okay. How often has it been?
2 days.
2 days? Okay. 2 days a week? Is that what you're saying?
How often they move? 2 or 3 days a week. 2 or 3 times a week.
You ever have any pain when you have a bowel movement?
No.
Any bleeding?
No.
Do you have hemorrhoids?
Yes. Inside.
Okay, so internal. Are you passing excessive gas?
No.
Belching?
No, I have been belching.
Has your doctor told you have any issues with your liver?
He hasn't told me I have.
Okay, so not to your knowledge. Okay, tell me about, we know about the high blood pressure. Have you had any swelling in your legs or feet?
No.
Haven't noticed it in your hands either?
No.
Has your cardiovascular doctor that done any tests recently, like EKGs or?
Oh, I've had EKGs before my surgery.
Okay. If you've had one in the last year, do you know if it was normal?
It's normal.
Okay. Have they checked you to see if your shortness of breath has anything to do with your heart?
No.
No, they're not reviewing that. Okay. So you're in menopause?
Yeah.
Do you remember?
I'm out of menopause.
Okay. How old were you when you had menopause?
I didn't because I had a hysterectomy.
Okay. How old were you when you had your hysterectomy?
Probably about 37.
Okay. And you had one pregnancy, is that correct?
Yes.
All right, never had a miscarriage?
No.
Okay. Tell me if you're having any urinary issues?
No.
Okay, what about having to go frequently? That hasn't been an issue?
No.
Any UTIs in the last year?
What's that?
That's a urinary tract infection? None? Okay. Not recently. Okay. Tell me about, dizziness. Have you ever experienced that in the last year?
I
Lightheadedness?
get that every once in a while, but I think it's mainly when I have sinus congestion.
Okay, so that's related to allergies, seasonal allergies?
Yes.
Okay. Do you wear glasses?
Yes.
Yes, of course. Right there on your face. Do you ever change from glasses to contact lenses? Just the glasses. Okay. What do you think about your hearing? Do you have decreased hearing on your right or left side?
No.
Ever have ringing in your ears?
No.
How about, you did say you have occasional dizziness. Does that ever accompany like a room spinning? Do you feel like
No.
that sensation ever?
Not that much.
Okay. Have you ever had a need for hearing aids?
No.
Do you ever have a discharge from your ears?
No.
Okay. You did mention that you get seasonal allergies. Do you have stuffiness today?
A little bit.
Okay. Having any runny stuff coming out of the nose? None. Hay fever, that is some sneezing today?
No.
But you have had a history of allergies. Okay. In addition to the medications that you provided me, do you have an allergy medication that you take?
No.
Okay. Tell me about your teeth and gums. Do you see a dentist on a regular basis?
Twice a year.
Two checkups a year. Okay. Now, have they done any recent work?
I had a tooth pulled.
Okay. Did they replace that?
No.
Okay. What do they tell you about the condition of your other teeth?
They're okay?
All right, very good. Any hoarseness today or sore throat?
No.
Good. Have you noticed any pain or stiffness in your neck?
No.
And since the removal of that thyroid growth, have you had any other swelling in your neck?
No.
None. Okay. You've never noticed another lump either? Okay. Do you think you're having any changes in your mood? Do you have mood swings?
I don't think so. Maybe when I had more pain, I may be a little more short or something.
Okay. Has your attention span changed at all? Can you still focus?
Yes.
All right. You ever feel faint?
No.
And have you had any blackouts in the past?
No.
You did mention some sensation of burning. Do you ever feel numbness anywhere?
No.
No numbness in your hands or feet or any of your extremities. You ever notice that you shake or have any tremors when you do that?
I do. I guess I'm not sugar level gets low.
Okay, so you do have that. Is that daily?
Yeah.
How often? Once a week? Less than once a month?
Yeah.
Okay.
Yes.
All right. Skipping meals?
Well, maybe I don't eat the right thing in a meal.
Okay. Okay. Yeah, there are certain things like protein that will help your blood sugar to stay level longer. So we'll give you some diabetic diet information today. Have you noticed that you've had problems with nervousness?
No.
Feeling tense?
No.
Is your depression medication taking care of any symptoms? And what about suicide? Ever think about that? Okay. In your muscles, you mentioned that you do have a thigh that gets, you do have joint pain when you're walking, and that's the front thigh. And do you also have swelling or redness in either of those legs? Anywhere in your body?
No.
Pain or tenderness anywhere that you haven't mentioned previously?
No.
Any stiffness anywhere?
My neck gets a little stiff sometimes.
Okay.
I think that's due to my back problem.
Speaking of weakness, do you have any problems with your grip in your hands?
Yes, I can open a lot of jars and that type of thing.
Both hands?
Yes.
Okay. Do you ever notice that you get cramps in your legs?
Yes, I do.
Is that on a daily basis?
No.
When does that happen?
Not on a regular basis, but it just takes spells where I will get cramps.
Once a month or more often than that?
Maybe once a month.
Any color changes in your legs? Are they the same color as the rest of your skin? Anywhere else in your body, have you noticed skin changes?
No.
I'm also interested to know if you have any moles in your body, if you've been looking at those to see if there's changes in that
I have
skin color.
moles, but they're not changing.
They're not changing in the size either?
No.
Okay, very good. And do you do self-exams of your breasts to check for lumps?
No.
Okay, that's something that's recommended monthly.
It all feels lumpy to me.
Yeah, so something to discuss with your doctor. And you should be checking monthly to get to know where the lumps are and are they changing. Okay, so let's address that down the line. I also want to ask you if you know that you're a bleeder, if you've had any trouble with that. Are you taking iron for anemia?
I do take iron. I'm a little anemic.
Okay. You haven't noticed if you're easy to bruise?
I'm very easy.
You are.
But I've
Okay.
always been that way.
Okay. Have you ever had blood after a surgery?
Yes.
Do you react to that blood?
No.
Okay. Has your doctor, other than the thyroid growth, have you had any other thyroid problems?
No.
Okay. Are you intolerant of the heat or cold if it gets very hot?
No.
If it gets very cold, you can tolerate that without any problems?
Yes.
Have you ever noticed that you're breaking out in a sweat and the room temperature or the temperature outside is normal?
Yes, I do that.
What brings that on?
I don't know. I just get hot when I'm working.
Okay, so in hot environments you do sweat. Other than that, you're not breaking out in a sweat in regular temperatures?
Yeah.
Oh, when you're working and active. Okay, well that's understandable. So some of the things that can indicate thyroid problems are heat or cold intolerance, and you say you don't really have that problem. If you're getting really thirsty or really hungry and you've been drinking, so you have to drink more water than normal because you have this thirst that bothers you all day. And you say you have no problems going to the bathroom frequently to urinate. All right, and have you noticed if the size of the gloves that you use or your shoes have changed in the last couple of years? So you're still able to use the same size shoe or gloves? Okay. Well, that is it, along with the medications that you have given me. I think that's a really detailed assessment of what problems that we need to address. If I have any additional questions, I will call you. Is it all right to call you at your home number? Okay, what's the best time to reach you there?
Anytime, mostly.
Okay. Well, I appreciate all the time today. Thank you for coming in, and we'll give you a call about your follow-up appointment.
Okay, well, thank you.
You're welcome.
Did we make it?